We are getting a deeper look now at how pharmacist burnout is possibly impacting your prescriptions. Earlier this month, we first told you about concerns of pharmacy mistakes during this pandemic. Let's bring in our investigative reporter, Candace Wynn, who has data showing an increase in complaints when COVID hit. Candace.
Yeah, Raj, data on actual pharmacy mistakes is limited because pharmacies aren't required to report them to regulators. So the investigative unit filed a public records request for the number of complaints the state received of medication errors harming and in some cases killing patients.
People only see us staring at a computer screen and we're clicking something, right?
Dr. Veronica Bandy is a pharmacist and pharmacy professor at the University of Pacific in Stockton. She says so much more goes on behind the counter than customers can see.
I mean, we're not only verifying the prescription and what the doctor or the other prescriber wrote on there, we're also looking at the previous things that the person's had, and then also the disease states. And also the drug allergies.
Dr. Bandy and nearly a dozen other pharmacists and technicians from the Bay Area and across California told our investigative unit that added workload and staffing shortages caused by the pandemic are pushing local pharmacy workers to the limit and putting patients at risk.
I feel like it does.
Absolutely.
State data we obtained through a public records request show between 2018 and 2019, the California State Board of Pharmacy initiated 138 investigations in response to complaints of pharmacy mistakes harming patients. But when COVID hit the next year, the board started 294 investigations, a 113% increase. And then the next fiscal year, which was all during the pandemic, that number jumped even higher to 367, a smaller but significant rise that includes reports of serious patient harm and death, according to regulators.
What was already an overburdened and fragile system had this incredible weight placed upon it.
Susan Bonilla is CEO of the California Pharmacists Association. She reiterates what the investigative unit first reported earlier this month, that these concerns are more prevalent at chain pharmacies. Multiple current and former chain workers tell us they're pushed to fill a certain number of prescriptions in a specific period of time.
Well, the chains are owned by large corporations. They have stockholders. They are very focused on their profits. When you're talking about an independent pharmacist who is a small businessman or woman running a neighborhood store for their community, they are really there for the patients.
These three big chains declined interviews with us, but all said in statements safety is their top priority. CVS pointed to a nationwide workforce shortage, and Rite Aid said it made temporary changes to store hours so workers could catch up on prescriptions. Dr. Bandy says customers can also help by remembering to be patient with prescriptions.
I know you've had a bad day, and we are the last stop on your bad day. But, you know, we all need to just take a breath with every healthcare provider and every interaction that we have.
Because pharmacies are not required to report most mistakes to regulators, the California Pharmacists Association says it's important patients and workers report errors to the state. We have information on how to do that on our website right now, NBCBayArea.com/investigations, as well as an explainer on how to double check your own prescriptions. Candace Wynn, NBC Bay Area News.